Very good morning to all the dignitaries and delegates. A warm welcome to all of you and welcome to the pre-conference CME. So I am Dr. Manjunath and Dr. Basuraj from Department of Physiology and Biochemistry here as chairpersons. And the first session starts with Dr. Ananda Balayogi Bhavanani. Very good morning, sir. Very good morning.
Namaste. Good morning, sir.
Namaste, sir. Namaste. So I will give a brief bio-sketch of Dr. Ananda Balayogi Bhavanani. Yogacharya Dr. Ananda Balayogi Bhavanani, MBBS MD, Alternative Medicine, DSc Yoga, is a director of Institute of Salatogenesis and Complementary Medicine and professor of Yoga Therapy at Shri Balaji Vijayapura University, Pondicherry. He has served as member of number of expert committees of Ministry of Ayush, including its steering committee of Yoga Certification Board, National Board for Promotion of Yoga and Naturopathy, Scientific Advisory Committee and Standing Finance Committees of CCRYN, expert committees for celebration of International Yoga Day and Yoga and Diabetes Program. He is a consultant resource person for WHO Collaborative Center in Traditional Medicine Yoga at Midney, New Delhi. A recipient of coveted DSc in Yoga from SVAS Yoga University, and is the chairman of International Center for Yoga Education and Research at Ananda Ashram, Pondicherry, India, and Yoganjali Natyalayam, Premier Institute of Yoga, Carnatic Music and Bharatanatyam in Pondicherry. He is son of successor of internationally acclaimed yoga team of Yoga Maharshi Dr. Swami Geetananda Giri Guru Maharaj and Yogacharini Kalaimamani Ammaji Srimati Meenakshi J.B. Bhavanani. In addition, he is a classical Indian vocalist, percussionist, music composer and choreographer of Indian classical dance. He is a recognized PhD guide for yoga therapy and he is the first Indian to be recognized as an IAYT certified yoga therapist by International Association of Yoga Therapists USA. In recent years, he has traveled around 20 times abroad and conducted invited talks, public events, workshops and retreats and been major presenter at yoga conferences at UK and USA, South Africa, Malaysia, Germany, Switzerland, Canada, Australia, New Zealand. He has been awarded with the Paduvai Kalaimamani by Government of Pondicherry for the year 2016 as well as 2023. With this brief introduction, I present you Dr. Ananda Balayogi Bhavanani. Dr. Ananda Balayogi, he is going to present on the topic Salatogenesis and Yoga Therapy. Over to Bhavanani, sir.
Namaste, sir. Thank you so much for the kind words of introduction. I hope my audio is clear from this side. Yes. So before I begin, I would like to thank the organizers for this opportunity to share with all of you. The work of PHYSICON over the years has been something we admire, and it is an honor, a privilege to be with all of you today. I'm going to start sharing my screen, and if the slides are not moving, please let me know. Yes. I hope my slides are visible, sir.
Yes, sir.
Okay, thank you, sir. So today my talk is on the understanding salatogenesis and yoga therapy. So the very first question comes, what is this salatogenesis? Because not too many people are familiar with this term. We are familiar with the term pathogenesis. What are all the factors that create pathology? Salatogenesis refers to all the factors that enhance health and well-being. So here we are looking at a paradigm shift today, and I'm going to look at it from the perspective of yoga therapy and representing our university, Shri Balaji Vidyapith, and Professor Jayaraj, who is at your university, is also guiding us here. So a privilege to be guided by that doyen of our medical field. We have an institute of salitogenesis and complementary medicine. So the question comes, how has this journey been from complementary alternative medicine to what is called today traditional complementary and integrative medicine? Initially, it was alternative. Now, alternative means either you can be there or I can be there. We both cannot be there. But then it has shifted to complementary, which means we can work together. So it is you and me working together. But the best term is integrative because there's no you and me, it is only us. And this is why the shift from alternative to complementary to integrative has been the modern journey. Health is a dynamic continuum. And the Indian tradition of healing understands that it is not just a state to be attained and maintained. And the lowest point on the continuum is death. The highest is the concept of immortality. We say asatoma sadgamaya tamasoma jyotirgamaya mrityoma amritangamaya. That journey from limitation to non-limitation. And in between lies the normal state of health and disease where we can function without hindrance. So we talk about a quadrant concept, the 4 quadrants. At the quadrant 3 is the region of ill health, whereas the quadrant 1 is the region of normal health. And we are constantly running between these two. But what do we want? The great yogis, including Shri Aurobindo, have talked of the concept of the super consciousness, the Superman, where we are moving from the animal level to the human level towards divinity. So the journey of health is not just a physical entity, but of a spiritual nature also. This has been very well brought out in ancient times by Aristotle, who talked about eudaimonia, which is a life well lived, where we fulfill our purpose. But this has also been talked about by the great psychologist Abraham Maslow as self-actualization. In the Japanese culture, ikigai. But why to go so far away? Swadharma in our Indian tradition, as exemplified by the Bhagavad Gita that says, do your swadharma, don't compare with somebody else's paradharma. So where does yoga fit into all of this? Well, as a medical doctor and a yoga therapist and someone who has spent my whole life in yoga, I am trying to bridge the gap between modern medicine and traditional yoga. And today, in the world, we have the International Association of Yoga Therapists, who is doing great work in bridging this gap with a journal also, International Journal of Yoga Therapy, that is Scopus and PubMed indexed. Numerous textbooks have come out, including my own textbooks on yoga therapy, incorporating aspects of how yoga can come into healthcare. If you look at PubMed, the search for yoga therapy gives about 5,000 plus hits, and most of these in the last decade and a half. Here at our university, we have the Institute of Salitogenesis Complementary Medicine with a school of yoga therapy, a school of music therapy, and more than 93,000 participants have benefited in the last 13 years. We offer courses ranging from PG diploma to PhD in yoga therapy with more than 150 publications in very good journals. What is the salitogenesis and who coined this term? Well, Aaron Antonovsky, he was a sociologist who brought out this term salitogenesis, which is in Latin, health, salus, and genesis from Greek. So Latin and Greek is the sources of health. But long ago, so long ago, very long ago, our great Maharishis called it swasthya. So we have had this concept of swasth and swasthya, but in modern times, we need a modern term also. And he has talked about a sense of coherence. Life should seem coherent if you are healthy. When you are incoherent, you are not healthy. And we see it with patients in the hospital when suddenly you give the diagnosis, you have a terminal state of cancer and we cannot guarantee how many more months you will live. Immediately they break down, the family breaks down into incoherence. But salitogenesis is about a sense of coherence. And this is why our words as doctors, we must learn to communicate so that health and wellness, compassion and empathy come more than just a hardcore, detached perspective. Because we are a friend and guide as a medical doctor to the patients who are coming seeking our care. They are care seekers, we are care providers, so we should provide care. That is a very important aspect to remind. This sense of coherence is the heart of salitogenesis. And it is a pervasive, long-lasting and dynamic feeling of confidence that most probably things will work out as we can expect. And it has been seen by numerous studies to correlate positively with perceived health, mental health, and quality of life. The three components can be understood as cognitive component, where my world is understandable. The second is a coping skill. My world is manageable. And the third is a motivational aspect. My world has meaning. So when you can feel, every one of you in the audience today or attending from distance, if you can have a sense, my world is understandable, my world is manageable, my world has purpose and meaning, congratulations, sense of coherence is good. But most of us don't. And that is why we need to compare pathogenesis. What causes the disease? How to avoid the problem? It is reactive against pain and loss, and it helps us to live. We can stay alive when we look at pathogenesis, but how to live life fully? Well, salitogenesis is about reaching that potential. And this is why the illness-wellness continuum, if you look at our treatment paradigm, has always looked at disability, signs and symptoms. But the wellness paradigm not only includes disability, signs and symptoms, but goes towards the other part of the spectrum, awareness, education, and growth. So I am suggesting today that we need to have a shift in our paradigm from what did I do today to treat disease and illness to what did I do today to create health and wellness. And this is why when we talk of yoga therapy, to be a competent yoga therapist, a healer, we require intelligence and empathy. Head and heart should both be working. We should be willing to share, understand our limitations, and be willing to embark on a continuously expanding learning curve. I often quote a statement, the day we stop learning is the day we stop living. And what is the big danger sign? Ego, ahankar, asmita. So coming back to our World Health Organization, we say health is a dynamic state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease. Now, 3,000 years ago, Maharishi Patanjali has given us Ashtanga Yoga, where we have the Yama Niyama, which are the social dimensions of health. When you learn about yourself and how to relate with others, you become socially healthy. Through asana and pranayama, you can develop physical and physiological health. Through pratyahara and dharana, the mental health by focusing the mind. And through dhyan and samadhi, the spiritual health. So all the four dimensions talked about by WHO are taken care when we live and practice Ashtanga Yoga. This concept of salitogenesis is swasth. And again, 600 BC, long time ago for all of us, Acharya Shushrut has defined health as samadosha, sama agnischa, samadhatu malakriya, prasanna atma indriya mana, swast ityabhidiyate. What a beautiful, balanced equilibrium. That is homeostasis. Malakriya, elimination of waste and proper elimination of toxins, and a stable state of the mental tranquility. This is where yoga therapy is within yoga. It is not separate from yoga. In 2019, just before the COVID, we shared a very beautiful paper on this. that we have to realize all of yoga is there, and inside that is yoga therapy. So we are applying the principle and practice of yoga to promote health and well-being within a therapeutic relationship. That therapeutic relationship is essential for healing. We are not talking of curing, we are talking of healing. And there is a difference between both. This is why Antonovsky has said the stressor comes in. Everybody who's alive has stress. If you don't have stress, it means you are dead. Basically, that's the meaning. Every living entity has to face stressor, creates a tension within our system. How do we approach that stress? When we approach it salutogenic, we move towards positive health. The stressor enables eustress to occur. When we take it negatively, stressor becomes distress and disease. The balance between eustress and distress, the choice lies with us. We can, and I often make a statement, nothing can stress us until and unless we allow it to stress us. We are the master. We have the master switch in the prefrontal cortex. I always say the buddhi, where we can make a distinction. And that is why we need to have this leap from a pathogenic orientation, always looking at intervention. Are we talking about health and wellness? Are we producing health? We need a culture of active health and develop health assets. This is why yoga therapy works at body, mind, and spirit level, creating healing, restoring function, reducing suffering, and creating community. Because healing is multifactorial. It is not just single factorial. You need lifestyle, you need attitude, you need relaxation, and you need breathing. So the psychosocial, we initially had the biological model, then we realized there's psychological, there's social, and now we realize spiritual. Bio, psycho, socio, spiritual model. Numerous studies have shown that yoga enhances biological health, psychological health, social health, and of course, the spiritual dimension also. How does this happen? My dear Satbir Khalsa at Harvard has talked about the 4 domains: the fitness domain, the self-regulation domain, the domain of awareness and spirituality, and all of this coming together to enhance global human functionality. For example, in fitness, flexibility, strength, coordination, self-regulation, emotional regulation, stress regulation, resilience. The key to dealing with the stressor is resilience and equanimity. Samatvam yoga uchyate, the Bhagavad Gita reminds us. And awareness, developing metacognition, not just cognition, metacognition, which is vairagya in the yogic concept, and transcendence, flow. And remember, through this, life, meaning, and purpose, which enhances salutogenesis. So physical, mental health, physical, mental, emotional performance, positive behavioral change, enhance social responsibility. Man is a social animal. Can we enhance our social dimension through social responsibility, values, and relationships, enhancing quality of life, life purpose, meaning, and spirituality? How does this actually happen? You are all physiologists and you will know the whole key to how yoga works: psychoneuroimmunology, psychoneuroendocrinology. And we know the stressor pathway that leads to disease. But what is the key? Perceived stress. I'm highlighting that, perceived stress. And every study we have done on yoga and yoga therapy shows a reduction in perceived stress. PSS goes down, PSS goes down. And if you reduce the perception of stress, the stress response doesn't occur. And if the stress response doesn't occur, you can start to tap into what is called the relaxation response. And all of these studies have shown this whole cascade of stress, all those parts, whether it is HPA axis or the sympathetic nervous system, whether it is glucagon, insulin, cortisol, renin, whether it is, dyslipidemia, yoga has been shown to go against the stress. It is the anti-stress. I say yoga is the vaccine against stress that is to come, and it is the antidote to stress that has already come. So yoga is both the vaccine and the antidote. And Streeter, in a beautiful study, has shown the reduction in allostatic load. See, the whole problem of stress is enhancement of the allostatic load that leads to the final stage of exhaustion. If you can reduce the allostatic load, you can take that elephant off your back, and what a relief it is. Because the moment we come into yoga, we are moving from the stress to the relaxation response. And this is yoga's greatest contribution to modern healthcare, that we can help the person heal through relaxation. And what type of relaxation? Self-directed relaxation. It is cost effective. You don't need somebody to relax for you. You can learn the technique. You can do it for yourself. We are empowering that self-efficacy of the individual. Because as long as I am stressed, I cannot heal. I want to heal. I want to heal. I want to heal. You will never heal. Only when you let go, we will automatically have better tissue perfusion. When tissue perfusion enhances, automatically healing occurs. And this is why yoga as a lifestyle. What type of activities do you have? Achar. What type of thoughts do you have? Vichar. What type of food do you put into yourself? Ahar. What type of relaxation and recreation? Vihar. And never forget the last one, last but not least, Vyavahar. Healthy relationships are so important for health. We need to create what is called by the Samuel Institute, optimal healing environment. In the healthcare system, we need to stimulate and support the inherent healing capacity. And this is why there is the internal domain, that personal wholesomeness, the interpersonal domain with the healing relationships between the care seeker and the care provider, the caregiver, and behavioral domain, adoption and practice of healthy lifestyles like yoga. And external domain, in the building also we need healing spaces and ecological sustainability. Lifestyle choices are the big key, because poor lifestyle choices are the key contributor to chronic disease. And though we know the healthy lifestyle, we lack the behavioral skill. We cannot sustain it. We know we should exercise, but we won't. We know we should avoid certain food, but we cannot. And that is why it has been shown comprehensive lifestyle modification programs, they will enhance the rapid, significant, clinically meaningful, and sustainable improvements. But the problem is, most human beings are so lazy, unwilling to change the lifestyle. So recently, my friend who's a diabetologist, he had a conversation with a client. So I'm going to recount that. The patient says, "Doc, how are my glucose numbers?" The doctor says, "Well, not great. You may have pre-diabetes, the stage before diabetes." I knew it. My parents are diabetic. Give me some medications I can take only once a day. The doctor says, "I'll give you a better deal. You need to take the medications only 0 times a day. Let's start lifestyle changes, diet, exercise." Patient says, "Why?" "So you can prevent diabetes and stop it in its track." "You mean," the patient says, "you mean to say the best way to prevent diabetes is to live like I already have it?" The doctor says, "Well," and the patient says, "Why would I want to prevent diabetes? Let it come when it comes, and then I'll do what is needed." This is the typical human approach. In the Mahabharata, there is a discussion between Yogeshwar Krishna, Shri Krishna, and Duryodhana. Krishna asks Duryodhana, "Duryodhana, why are you like this?" Duryodhana says, "Krishna, I know what is wrong. I cannot stop doing it. I know what is right. I cannot bring myself to do it." And he says, "Krishna, you are that Paramatma. You are the Bhagavan. So you are in all Atma. So that means you are in me. So if I'm like me, it is your fault." This is, I call it Duryodhana complex. I know what to do, I will not do. I know what to not to do, I will do it and find somebody to blame. Parents, teachers, elders, wife, husband, mother-in-law, daughter-in-law, blame somebody. So I'm going to conclude here by saying we need to focus on wholesomeness, the whole person approach, not just the body, the emotions, the mind, the spirit. and move from dukkha, which is suffering, to sukha, which is wellness. At our own university, we offer a yoga abhyasa program. This was suggested by Professor Jayaraj when he met me. He said, Dr. Ananda, do you give yoga to all the students? You're giving it to patients. He said, until and unless you give it to all students, I won't accept you have a yoga center. And so you can see all our medical students, nursing, dental, physiotherapy, pharmacy, they all have yoga as an elective course, as co-curricular, extracurricular, and in nursing in the curricular activity. You can see in the classroom itself, we take it there, we go to the classroom, we work through the CMEs and other activities. The nursing candidates, they all come, the nursing staff come to us for the yoga session to take it into patient care. And our former Vice Chancellor, my own guru of medicine, Professor Seduraman, who retired from JIPMER and became our Vice Chancellor, he opened our heart and mind to salitogenesis. And he made a statement, becoming whole. You have to have that wholesomeness is what healing is all about. So with my gratitude, dhanyavadaha to each and every one of you. This is my 10-member team in the School of Yoga Therapy and Music Therapy at Shri Balaji Vidyapith. And I would like to thank our chairpersons and the organizers for this wonderful opportunity. Dhanyavad. Thank you so much.
Thank you very much, sir, for your lucid presentation in the morning hours. Really, it has kindled a light in the soul. Definitely, you have made a day wonderful. I think the whole day will go with this kind of charming only. Thank you very much. On behalf of our university, we extremely express our thankfulness to you. A wonderful speech on celtogenesis and yoga therapy. You had opened the avenues in your own institution, Vidyapith, and also in our institution we have got a dynamic leader, Dr. Yoga Guruji, Dr. Jyoti. She is also doing a wonderful job in our institution. In the same line, Dr. Jairaj sir, he is also after her, and she is doing lot of work in our institution, and almost single-handedly she is managing the particular work. A lot of work. Thank you very much, sir. It's a very wonderful speech, a lucid presentation. I am handing over the mic to our chairperson, Dr. Basuraj.
Sir, my name is Basuraj, sir. I want you to stress a little bit about pursue stress, sir. Please, sir.
Yes, sir. So what happens is that we as physiologists, we know very well that the whole stress response depends on us perceiving something as being stressful. So, for example, you know, if one of my classmates from my medical days at Datta Megi Institute of Medical Sciences, in those days, we were under Nagpur University. So if one of my classmates calls me up, when he calls me, he will not speak parliamentary words. It will be unparliamentary words. He'll call me all sort of nicknames and all the Hindi abuses before he says hello. So the moment you take the phone, that is how friends talk to each other. Now he is using abusive terms, but I am not getting stressed. In fact, my enkephalin, endorphin, serotonin is all becoming more because I am saying in Tamil, we say Nanbanda. Hey, dost hai, he is my friend. And you have that sense of bonding and closeness. You don't get stressed. But if I'm walking down the street, yesterday I was in Bangalore at RV Institute for a yoga therapy conference. If I'm walking down the Bangalore street and somebody uses one of those abuses to me, you think I'll feel, oh, he's my friend? Immediately, how dare you use that word? Don't you know I am professor? Don't you know I'm Yogacharya? And all my stress response will kick in. The moment we start that limbic overactivity, we have no chance of stopping it. So perceived stress is above limbic activity. That is what I'm stressing here. So I'm stressing that our prefrontal cortex is where we can choose the attitude towards what is happening to us. Somebody is doing something. Instead of saying, oh, he doesn't like me, I can say maybe his circumstances are like that. And because of that, he is like that, and forgive him. When Jesus Christ was nailed up on the cross, he didn't say, "Oh God in heaven, kill all of them, destroy them." He didn't even say, "Save me." What did he say? "Father, forgive them." See, that is the attitude where you move from distress to eustress. So the same thing that can be distressing can be eustressing, and the same thing that is eustress for one person can be distress for another person. And this is why often a promotion and a raise should be eustress, but sometimes it is distressing because we know now we'll have more work to do. So, the moment you say, if you say, I'm getting more money, I become HOD. When I became director, I had eustress. Very nice, director. Now I can say director. But then the amount of work that I get becomes a distress. So how I perceive it, the world is as we perceive it. And all the yoga studies, till now I have not seen any yoga study that has not shown reduction of perceived stress. PSS scale will always be going down in all yoga studies because the practice of yoga works from the body to the mind, somato-psychic and psychosomatic. We always talk psychosomatic. So psychosomatic is the impact of yoga, but the mechanism of yoga is somato-psychic. We use the body to influence the mind, and by influencing the mind, we influence the body. I hope that helps with that answer.
Thank you, sir. Thank you, sir.
Thank you.
My special wishes to Dr. Jyoti. She visited us some time back, and one of her PhD candidates, I was able to do the evaluation of a synopsis recently. I don't know if this should be public information, but anyway, so we have a working relationship, and we hope that both the universities can have an MOU to take forward this activity into a mutually beneficial, healthy activity through the science of yoga and maybe even music therapy. Thank you so much.
Yes, sir. Yes, sir. Questions from the audience?
Good morning, sir. This is Dr. M.B. Patil, Vice Principal and Professor of Surgery. Nice, wonderful talk, sir. As explained by you beautifully. But again, since we are a big team of professionals, doctors working in an institution, already you told about perceived stress. A little bit about professional stress, sir. Because we are university working, everybody's working. I'm proud of my colleagues. But somewhere here and there will not be able to meet up the targets and all. I know it's a probably difficult question for you also, but few notes.
Do you want a politically correct answer or the realistic answer? So we all know the impact of NAC. We all know the stress of being on the IQSC teams. We know the deadlines that often are killing us. I think what is important for us is to realize what a great blessing we have to be born human. I think this is where it all starts. Aridu Manidavai Pirathal Aridu, says the great Tamil poetess Avayar, to be born human is the greatest opportunity. So first of all, to be born human is a great opportunity. Not to have any major deformity and disease is the second great blessing. On top of that, all of us as professionals have a good education. We have a decent job with a salary that we may not feel is exactly what we deserve, but is good enough compared to what others are getting. People are living off 5,000-6,000 per month. So, when we have more, we should be grateful. On top of that, we have the opportunity to work with patients, with our students, guide other human beings on this noble path in a noble profession. And we have the responsibility as an institutional head to guide the institutional future. So if we look at all of this as an opportunity, it will become eustress. So responsibility as an opportunity is the way I feel we can move forward in this professional stresses. The second thing is, we are born with a purpose. It is our swadharma. So if we are a professor, how can I live that purpose? By guiding my students to the best of my ability and actualize my potential and the potential of that student. If I'm in a department, how can I contribute to that department, enhancing my upliftment and the upliftment of the department and the upliftment of the university, uplifting the nation, uplifting the world and the whole academic community. Every time I publish a paper, it is not for the sake of Bhavanani et al. To be quoted in PubMed or Scopus. I am publishing for the sake of yoga and yoga therapy to become a recognized therapy along with the medical system. So if that is my purpose, the small ants will prick us. There will be some memos, there will be some notes. In a meeting, we'll be criticized. Why are you posting on social media, Dr. Ananda? It is all, you are only boosting ego. I say, I am posting for the sake of the institute. So my ego may grow, but the ego of the institute is also growing. So when we can identify and it becomes our passion, when something is my passion, my work becomes workship. Worship is workship. My work becomes my method of worshipping the universe. You call it Allah, you call it Christ, you call it Rama, Krishna, it doesn't matter. I am offering samarpanam, my effort for the sake of greater good. Nishkama karma, as Bhagavan Shri Krishna says in Bhagavad Gita. I feel this type of thing is one. Second, treat others as you wish them to treat you. This is a very clear-cut fundamental rule of my life. Give respect, respect will come back. Give gratitude, gratitude will come back. Give love, love will come back. And even in my life, I give money, it comes back. For many people, it doesn't. But I have found even with material things, I have a motto, sharing is caring. The more you share, the more you grow. And relationships, the last thing I'm going to say, relationships should be based on what you can give to the relationship, not what you can get from the relationship. If your relationships are based on getting, you will never be happy, take it for me, for granted. If your relationship is based on giving, you'll always be happy. So give, 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 forgive, and forget, because getting is not going to happen. So forget about getting and forgive and give, and you will be happy as much as you can be within your human limitations. Conditions apply, terms and conditions apply. Thank you, sir.
So any questions from the audience? Thank you very much, sir. We congratulate you and heartfelt thanks from our university on behalf of the staff members and organizers of the PHYSICON. Thank you very much, sir. We will be in touch with you. Anyhow, Jyoti is in touch with you. We also will be in touch with you in due course of time. Thank you, sir.
It will be a pleasure. Thank you so much and have a wonderful conference.
Yes, sir. Yes, sir. Thank you, sir. Thank you, sir. Thank you for your blessing.